Good morning. One important question of using AI in medicine is how to use it to drive high-value care. One important application area is to use machine learning and EHR data to track disease progress and predict outcomes and risks. About 3 years ago, I met 2 palliative care physicians, and we realized that we may use AI to find patients who will benefit from the early palliative care interventions. Society is aging, and many patients are living longer with chronic diseases, often experiencing many symptoms and aggressive functional decline. In 2014, the National Academy of Medicine issued a report calling for a significant increase in the depth and breadth of palliative care delivery for the seriously ill patients. A timely referral to palliative care can raise the quality of care for patients and their families. The patient may have less emotional suffering, and they are more likely to have their wishes known and followed. It can also reduce non-beneficial and unwanted medical care and reducing the cost. However, one of the biggest challenges and one of the critical first steps in expanding palliative care is identify those patients who can benefit the most. This is like finding a needle in a haystack. We need help to predict patients' clinical trajectories, identify those with unmet needs, and determine the right time to intervene. In current population management, current algorithms generally target patients with high healthcare utilization. And in clinical practice, many clinicians hesitate to provide prognosis information to our patients because they are concerned about the accuracy of prognosis and afraid of causing harms to our patients. Therefore, there's an urgent need to leverage information technology and the EHR data to provide decision support for providers. There has been research exploring using EHR data for predictive modeling in general. The complexity of the data make most modeling efforts really difficult, particularly when you're using large quantities of longitudinal clinical notes. Here I use dementia as an example. Dementia is very costly and have high mortality. And take care of dementia patients present unique burdens and challenges for their caregivers. In this figure shows a sample of 7,800 patients. They have over 400,000 notes in our EHR data over patients' last 2 years of life. And in the last months of their life, they can have more than 100 notes. To track and understand the cause of the disease and which care the patient received over their last 2 years of life, we conducted automatically topic modeling to capture the various trends of the themes mentioned in the notes over this period. The patterns of generated topics provide us unique insights, which not often documented in the structured EHR data. So we are learning we could not otherwise learn if we only use structured data. We used the topic modeling and generated hundreds of topics to understand the disease progression and the clinical care. So here are a few examples. The left figure shows that as patients towards death, they have there's a decreased trend of mobility and an increased trend of sit-stand assistance. The right finger shows an increased trend of swallow functions and nutritional status, which in line with the advanced patients' worsening capability of feeding themselves. And we also see the flattened trend of artificial feeding, which is consistent with the scientific evidence that feeding tubes may not be beneficial for this population. We then developed a deep learning neural network algorithm to predict mortality using longitudinal clinical notes. The system involves NLP preprocession, topic modeling, feature concatenation, and a deeper learning neural network. Our preliminary work shows promising results in predicting 1-year and 2-year mortality for dementia patients. Our model achieves an ROC curve at 0.95. So we further validated our model using a set of 266 patients who were screened by clinicians using the surprise question, which asks, would you be surprised if the patient died in the next 2 years? Our model performs better than clinician screening. So on this graph, the dots indicate clinician's performance. It's both of the dots with the nurses on the left and physicians on the right. Both dots and the curve indicating when we match the model's sensitivity to the clinician's performance, our model achieves a better specificity. In addition, our model can track and visualize the clinical important topics used for each patient prediction, which make the model, the result interpretable. So for the next steps, we will enhance our model by combining other data sources and put it into practice to assess its feasibility and impact. We will also build our tool to other health institutes and expand it to a wide range of applications. For example, we use similar methods to mine nurses' notes to identify nurses' concerns, which we can use to predict patient deterioration in the inpatient setting. We also use similar methods to mine information related to malpractice, all of which will improve quality of care, safety of care, and reduce the cost. The approach I present here is just one part of our broad comprehensive solutions, terms. Our team has developed advanced NLP and machine learning algorithms and applications to support clinical documentation, information extraction and encoding, knowledge discovery, clinical support, and other research efforts. Thank you.